I'm Adam Ganucheau, Executive Editor and Chief Content Officer of Deep South Today. Welcome to Families Count in the Deep South. We scheduled this conversation around last week's release of the latest kids count data because the numbers give us a fresh look at child well-being in Mississippi, Louisiana, and Arkansas. If you pay attention to policymaking in any of these three states, you likely know all about the kids count data and how helpful it is to policymakers, politicians, academics, journalists, and everyday people. For Deep South Today, the matters covered in the data are local. Our newsrooms, Mississippi Today, Verite News, and The Current, cover communities across this region every day. And something we're incredibly proud about is that very soon we'll have a team of journalists doing the same work across the state of Arkansas. Across our network, we see how policy, school systems, healthcare, childcare, and family income shape what children can count on and who's really being served by our society and who might be getting left behind. The Kids Count data helps put those conditions in context. Today's conversation, which we're so excited about, is a chance to ask what the numbers show, what they miss, and what people closest to the work believe needs to happen next. This virtual forum begins a series we'll continue in person later this year across the region. I'd like to thank the Annie E. Casey Foundation for sponsoring this forum. Thank you as well to our speakers and to everyone joining us today. Now, at this time, I'm pleased to introduce our first speaker, Leslie Boissiere. Leslie is Vice President of External Affairs at the Annie E. Casey Foundation, where she oversees the Kids Count effort, policy reform and advocacy, strategic communications, leadership development, and national partnerships. Her work at the foundation has included a senior fellowship focused on youth well-being in the South and Southwest. And earlier, she was Chief Operating Officer role for the foundation-supported Campaign for Grade Level Reading. Before joining Annie E. Casey, Leslie brought more than 15 years of executive experience across the public and private sectors, including a vice presidency at AARP focused on members' financial security and a tenure as executive director of the White House Council for Community Solutions. Leslie, thank you so much for joining us today. Really appreciate you being here with us.
Thank you for having me, Adam.
Of course. Leslie, you know, this work to us as journalists in the South, as, like I said, policymakers, people who might be watching our stream today, watching this event today, we know this work. It's so important. We've covered it for years. We've studied it for years. We've come to rely on it as a true sort of barometer for where our states really are relative to others and where they need to head. Overview question for you, since you led this work. Can you walk us through what the 2026 data shows specifically about these three states, Arkansas, Louisiana, and Mississippi? Where do these states stack up relative to the rest of the country, and what trends may be moving in the right or wrong directions?
Absolutely, Adam, and thank you for the question. This is the 37th edition of the Kids Count Data Book. We started producing it in 1990, and we look at the well-being of children using 16 indicators in 4 different areas: in education, economic well-being, health, and family and community. This year we added a score. So states are scored on from 0 to 1,000, 0 being the lowest and 1,000 being the highest. And it helped us to be able to pinpoint even more specifically how states are doing both over time and relative to each other. The national score is 547 for the country, and the range is from 838 for the number 1 to 271 for the lowest ranked state, which is unfortunately Mississippi. But we also saw that all states from the highest to the lowest rank have room for improvement. And there are some great examples in the states of Arkansas, Louisiana, and Mississippi, both of places they're doing well and places where they have improvement. So if we look at Arkansas as an example, Arkansas is 43rd in the nation with a score of 427, which is below the national average. They have seen declines in the period that we're looking at in the data book, which is 2019 compared to 2024. Significant declines in education and also in health. And the decline in health is largely driven by the number of uninsured children in the state in 2024 compared to 2019. Louisiana is a similar but different story with mixed results. So Louisiana is 48th in the nation. It is. I was born and raised in Louisiana. Full disclosure.
Yeah.
So it is very dear to me, and it tends to rank in the bottom three states. However, what Louisiana did about a decade ago is pass legislation focused on early reading and education. And as a result, even though it's 48th in the nation overall, it's 35th in the nation related to education. Louisiana also is one of only 3 states that showed overall improvement in child well-being and significant improvement in the area of education. So again, there's room for every state, no matter where it's ranked, to pass policies that help children to do well. Mississippi is a very similar story. Mississippi was 50th in the nation this year with a score of only 271. Mississippi was also last in the country on health with an overall score of 122, which is significantly below the national average, which is 607. Again, Mississippi passed legislation in 2013 focused on literacy. As a result, they are 16th in the nation in education and saw significant increases in their score on education. So it just shows that from the top ranked state to the lowest ranked state, there's room for improvement. And when leaders invest in policies that support children, children do well.
Yeah. Thank you for that overview. I think just to make it clear for anybody who may be watching this on our live streams, anywhere you're watching, and you haven't yet seen this data, I think we're going to put a link at the bottom of the screen here for you to go check out. It's interactive. You can select your state once you click on that link. There it is at the bottom of the screen there. You can select your state and see some of the rankings and all the factors that go into this. Leslie, I mean, it really is quite impressive how much data that you and your colleagues pull together for these annual reports. Was there anything in here, that was a great overview of our 3 states. Was there anything in here that surprised you? Any findings that surprised you, areas maybe where the states are doing better than expected or decline has been sharper than expected?
Well, a couple of things that we know. One is that there was no state in the country that is consistently meeting the needs of all kids. From if you look at a state like New Jersey, which is number 1 in education, and yet 2/3 of children in New Jersey aren't reading on grade level by the end of the 3rd grade. So that was one thing. The second is that overall well-being for kids in the country have declined in the period from 2019 to 2024. That's because of real challenges from the pandemic learning loss in terms of education outcomes. 47 states in the country declined in the area of education, with the exception of Mississippi, Louisiana, and South Carolina. So the 3 states in the South were the only ones that improved in education. And the other thing is that even the lowest ranked states showed improvement. We gave the examples of education in Louisiana and Mississippi. A couple of other stats that sort of jumped out. One is in Arkansas, the significant declines in education as well as in health. I wouldn't say we're surprises, but were certainly things that were on our radar. And the other one I would lift up is for Louisiana and Mississippi. Both states have the 2nd highest poverty rate in the country. 1 in 4 children in Louisiana and Mississippi live in poverty, compared to a national average of 20%. So in terms of things that caught our attention, those are several of the ideas.
Yeah. Covering the states we cover in the Deep South here, we're certainly pretty used to rankings being low. The worst rankings typically were at the top of that list, and the best were at the bottom of that list. And I just want to make it clear that I think that people who as journalists, we're covering these issues, but there are plenty of people on this call who are policymakers who are really trying to help move the needle. I think that it's important just to acknowledge, we're not trying to make light of this. I think that having a clear, keen understanding of where we are really does help us to decide how best to move forward. I think that's a standard that most everyone can agree on. With that said, as you and your team have been putting together this data for this year, and as you're looking at some of the overview analysis of it, I mean, what does the Kids Count report annually measure that maybe traditional metrics like this miss? I mean, and I guess the second part of that question would be, why does that matter for how everyone, policymakers, advocates, journalists, everyday people respond? I mean, what sets this apart from everyone else who's tracking stats like this?
Absolutely. There are a few things. Number one, I would say we're looking at publicly available federal data that's consistently measured in all 50 states. So that's one thing. The second is, I mentioned we're looking at 16 different indicators. So we're not just looking at poverty. We're looking at the drivers of poverty. We're looking at access to healthcare. We're looking at high housing cost burden. So a number of different factors. And the last thing is that we're looking at a period in this report from 2019 to 2024, and we were very deliberate in choosing that period because 2019 was the last full year before the pandemic. And there were significant policies that were passed. And so looking at data in that time period, we can look at 2021, for example, and we see that poverty nationally was at a historic low of 5%. And that's the direct result of some of the pandemic era policies that were passed, like the expanded child tax credit. So we see that SNAP and TANF and housing vouchers and other programs that support kids have a direct impact on the overall poverty rate and the well-being of kids. And we not only see it at the national level, we see it at the state level as well. So if you look at a state in the Southeast, like New Mexico, in 2023, they passed an expanded child tax credit that went from $175 per child each year to $600, so significant increase. And as a result, they saw a significant increase in the economic well-being of kids in that state. So what the Kids Count data book allows us to do is to pinpoint, right, with specificity on specific indicators, how policy correlates. Passing policy for kids can be correlated with improvements in outcomes on the well-being of kids.
Yeah. I'll ask my colleagues just one more time to put the link to the data just at the bottom of the screen here for anyone who may have joined us a little late. But last question for you, Leslie. I mean, thinking about what we do as journalists in the Deep South. I mean, so often, whether it's folks or entities that create these lists and try to paint the Deep South as really monolithic in national conversations about things like poverty and child well-being. What would you say, if anything, this data this year reveals that complicates or challenges that notion that everyone in the South is the same in regards to all of these key indicators that you guys look at and study?
Yeah, that's as a daughter of the South, I have to say I do take offense. I mean, there are certainly
hard, right? That's really keep seeing that over and over again. Yeah,
there are certainly similarities among states in the South. Southern states tend to have among the highest poverty rates, for example. But what the data shows us specifically this year is where states are doing well by kids and where there's a need for more investment. We learned a few things. We learned that where kids live matter. The state and local policies that are passed are different. Neighborhood characteristics are different. Resources and infrastructure are different state by state. We also saw that states in the South are willing to follow the data and the evidence and to invest in policies that work. We saw that in the great examples of Louisiana and Mississippi, as well as others. We also saw that all states have strengths and all states have the opportunity to pass policies that can improve the well-being of kids. There's room for growth for everybody. And I think the most important thing for me is that we saw that progress is possible, right? Mm-hmm. It can be, as someone from this year 48th state, but generally bottom 3 states, it can be pretty heavy, right? If you're in that state and you're working day by day, year after year, trying to pass policies or advocate for policies that work. But we saw progress even in the most lowest ranked state that can be directly correlated to really smart data-informed evidence policies that were passed in those states. So all of those things show us that the states might have similarities, but they're definitely not the same. And there's a real opportunity for advocates and policymakers in those states to follow the data, to look at what's working well and where there's more investment needed, and to not invest in a single set of policies that will address the South, but in those specific set of solutions that can address the very particular challenges that are facing children in that state.
Of course. And to your point earlier, no state is doing this perfectly, any of it. There's always work to be done. Leslie Boissiere, thank you so much for your time with us today. Thank you and your team for putting this data together in one place. I think I can speak on behalf of many, many, many people across certainly our region. We're really grateful to have it. It's such a valuable resource. And, thank you for the work you're doing. And thank you for being here with us today.
Thank you for the opportunity, Adam.
Of course. Well, I think that sets us up really nicely for the second portion of our event today, where we get to have a very exciting panel discussion with three advocates, experts who are working tirelessly across all three of our states to serve the very people included in this report. I'd like to introduce them just very briefly, and we're going to jump right into the conversation. First, joining us is Keesa Smith-Brantley, who is the Executive Director of Arkansas Advocates for Children and Families. Next, we have Dr. Ashley Parker Sheils, CEO of the Children's Foundation of Mississippi. Last, but certainly not least, we have Teresa Falgoust, the Chief Data and Impact Officer at the Agenda for Children based in Louisiana. Thank you three all so much for spending a few minutes with us today to help us better understand what this data actually may look like on the ground in all three of these states. Just to jump right into this conversation, I'm going to ask all three of you to maybe briefly give an answer to this kind of bigger overview question. This kids count data gives us a really good overview picture, as we just heard from Leslie. But what does it really feel like on the ground in your state? Is the report's picture consistent with what you're seeing in your work and on the ground day to day? I'll toss it to Keesa first.
Yeah, thanks, Adam. So it's definitely a pleasure to be here with you all today. I think that the kids count data reinforce what we know, which is that unfortunately there are areas pertaining to children that we've stopped in Arkansas making the necessary investments that we need to make. In the last, I want to say 12 years, we've really prioritized tax cuts, which have taken almost over $2.5 billion out of our state general revenue, which means that there were programs for children that have centered children for years in our state, definitely in the areas of early childhood education, where we're just not making those investments anymore. And we are seeing through the kids count data where we're losing ground. And so this kids count data always reinforces some of the things we say pertaining to the needs for children. And this year's report really reinforced the fact that we're not making the necessary investments we need, and equally not making the investments that we used to make in the areas of children that had us doing much better in the past.
Sure. Ashley, what about in Mississippi? What is this data showing you or telling you, if anything, about sort of the state of things on the ground in Mississippi?
Yeah, again, thank you so much, Adam, for having us and opening this conversation up. And we are so grateful for the chance to discuss this. I will say that in Mississippi, sometimes there's the sense of, oh, last again, right? Should we just pack up and go home, pack up and go to one of our neighboring states? But I will say there's been a lot of excitement around the Mississippi momentum in education, and knowing that we can be proud when investments and policy and hard work align, and great things can come of that. And so there has been some excitement and renewed sense of, look what can happen when. But I will say there's also that sense of, okay, we can't stop here. We can't become complacent. We can't say, oh, just because we improved in education, our work here is done. Now, what are we doing to help children in the area of health? What are we doing to promote more economic well-being, to have more stable economic well-being in families? So, I will say the work on the ground, I am inspired and so excited to know that there are so many here in Mississippi, nonprofits and organizations that are really rallying around children and families. And we've had the chance to celebrate some of those recently through our foundation, but the work's not finished. And so we have a lot left to do.
Of course. Teresa, what about Louisiana? Does this ring true in your state?
Yeah, I would say the Kids Count data does a really good job of providing kind of that hard data that shows the realities that kids and families are facing. It also shows where we're doing things right. Louisiana has a relatively low rate of uninsured kids. We have a pretty high rate of kids who are connected to early care and education. And that really represents a lot of the commitments and investments the state has made over time, along with federal investments. And so I think that's really important to note is that is a partnership of local, state, and federal governments to make these things happen for kids. I think one area that you don't necessarily see in the national data book is kind of the existential threat that we see in Louisiana as we're having a lot of out-migration from the state and falling birth rates. We know that that's going to make it that much harder to make lives better for children and families as we're seeing families move out of the state and school systems having to do the same amount of work with less funding per child. So that's kind of an existential threat that we're looking at, but there's so much work to be done. And it's great to see the data book really capture so much of that.
Of course. I want to stay at the sort of specific state level for a minute, and then we have some questions that are kind of a little bit broader for everybody. But Teresa, I'll keep it with you for now. I mean, once again, as Leslie said, Louisiana ranks, among the very lowest on child poverty numbers in the country. From a data perspective, I mean, how do you take this data that you can see here that isn't necessarily news to anybody and apply it? I mean, what are the levers that you could pull that might actually move the needle ahead on this? And in Louisiana right now, are any of those levers currently being pulled?
So I think the really great news is that we already know what works. We can end child poverty by connecting children and families to the programs and resources that they need to make ends meet. And the United States passed the child tax credit that expanded in 2021 temporarily, and we saw child poverty decline to the lowest rates in my lifetime, certainly. And then when they stopped that temporary increase, we saw poverty rates shoot back up. And so I think we already have a roadmap there. And we also know from the data that programs like Section 8, LCHIP, Medicaid, and SNAP are all super effective at reducing child poverty. So I think some of the levers that we can think about in that are to make sure that we're investing properly in those programs, that we're preserving access to families, and that we're removing many of the barriers that families are facing in accessing those benefits. But I think long term, we also need to make sure that we're looking at other levers that work, because in order to move families and children out of poverty, we need to get more parents connected to living wages and jobs that really help them take care of their families. And it's no surprise that Louisiana not only has one of the country's highest rates of child poverty, but we also have one of the highest rates of children and families where no parent has full-time year-round employment. So things like investing in apprenticeships, on-the-job training, those are all things that can help parents get those jobs. And we also need to look at things like childcare, because if you don't have a safe place to have your child during the day, you're not going to be able to participate in the workforce. You're not going to be able to work as many hours as you want.
Yeah, that's such an important point. I know so many people have tried to highlight that, especially since COVID. I mean, I think Leslie mentioned that COVID really did exacerbate so many of the problems that we want to dig into today and looking at a report like this. But there are some bright spots. I mean, Ashley, I want to come to you next because Leslie mentioned this, if it's hard to pick up a newspaper even nationally and not have heard of the Mississippi Miracle, the policy that was enacted several years ago, that has brought up literacy scores, particularly among third graders in the state. That's a win, of course. And I think you always want to hold that up as a genuine win. Looking at this report, though, you can't help but see reading and math proficiency for eighth graders in Mississippi not necessarily elevating to those sort of third grade, fourth grade numbers there. So I guess my question for you, Ashley, is how do you hold up the win of the Mississippi Miracle and the obvious effects that it has on the data that we can clearly see in the report versus not losing sight of the pretty profound amount of work I think that still remains and what might be threatening to reverse all that progress that we've seen with the Miracle?
That's a great question, Adam. And while the Miracle is a catchy moniker, I like to go back to the Mississippi momentum because this didn't happen overnight. It didn't happen just out of the sky. There was lots of things that really had to happen for this progress to be made. Policy choices, sustained investment, focusing on evidence-based practices, the idea that we're looking at what works. Now, how do we make sure we know what we're doing works in the classrooms and in the contexts where it needs to be applied? So thinking about universal screeners and catching kids that were having reading difficulties early, thinking about putting high quality instructional coaches and specialists in schools where those proficiency rates were lacking, thinking about where parents fit and how reading coaches and investment in supporting families as they're working to support their children's academic success. All of these pieces that were part of the 2013 legislation, in addition to the legislation that opened up more opportunities for children to have high quality early childhood experiences. We are excited that Mississippi is one of 6 states nationally that continues to meet all of the near benchmarks for early childhood excellence and quality. And so when you're making sure that you are putting quality in and getting great results, I think one of the threats to that then becomes complacency. Do we say, oh, well, we did it. That's great. Now we're 16th. There's a lot of room to continue growing. As you mentioned, those proficiency rates are still not where we want them to be, while better than they were. So I don't think we're becoming complacent. I think, if anything, the taste of success has motivated us to want to take it a bit further. So there was recent legislation in our state to now expand what's been happening in the early literacy space to 4th through 8th grade. So same idea of screening and making sure we're using diagnostics to determine where there are deficiencies and where additional support needs to be provided, and thinking about that from an individualized standpoint, that it isn't just one size fits all, but really being intentional with what supports are provided to children that are showing those reading difficulties in 4th through 8th grade. There's a math component now, this idea of, we know the science of reading, so what is the science of teaching math, and how do we make sure we're applying that? And so I will say 2 things can be true. We can celebrate this success, and it is real, and it is powerful to see the progress. And these students that are represented in these numbers, these are real children that are demonstrating real growth, and we're very, very proud of them. But we also have to acknowledge there's more work to do, and we can't just rest easy on the fact that now there's been improvement. If anything, that has to motivate us to continue to do this in the other sectors, because children don't experience these aspects of their life in isolation. Health, nutrition, childcare, all of these other portions that have to come together to really have a system that works for them is where we see there being potential. But I think I would be remiss if I didn't say one other threat to this progress is Mississippi is still sitting last in the national average of how much we pay our teachers. Our state average is the lowest in the country. So I can't be okay with the fact that these teachers are investing so much and pouring so much, and we're seeing these great results, to also not acknowledge that they deserve every penny that they're being paid and more.
Yeah. That's one of those things I feel like, Mississippi, Louisiana, and Arkansas are always trying to battle it out for not being on the very bottom of that teacher pay list. It seems like a perpetual legislative debate, one of those things that does clearly correlate with educational outcomes, and something that's very important to all our states. That's why I think Deep South Today, our network of newsrooms, is so uniquely positioned to cover these things, at least from the journalistic side, because obviously our states are different in so many ways. Leslie and I talked about a little bit of that. Y'all are talking now about that. But a lot of the problems and opportunities are very similar across these state lines. So love this conversation. And with that, Keesa, I mentioned earlier, like, we're really excited to, at Deep South Today, get to launch a new newsroom there later this year. It's going to be called Arkansas Today. And we're really excited about that. But you're on the ground there. You've been on the ground there. Let me ask you a question just about it looks like, kind of, looking at the coverage and the sort of happenings of Arkansas these past, 2 or 3 years, there has been some legislative movement, at least activity around child welfare and early childhood initiatives in very recent legislative sessions. I just want to ask you for your take. I mean, where are the real pressure points right now for families in Arkansas? And is the policy environment in Little Rock or elsewhere moving in a helpful direction for children and families there?
Yeah, so and first let me say, Adam, that we're really excited to have you all.
Yeah,
As a former journalism major, I will say the more news sources that are there digging deep into what's happening in states is important, and definitely more that will get in depth about children
indeed.
is
Yeah.
definitely what we want to see. And I will say, the verdict is still out pertaining to the legislation. Governor Sanders, when she entered office, had a very, very large education bill called the LEARNS Act. It made a lot of national news because there were several changes. It did bring what is called the educational freedom accounts, which is universal vouchers to our state. There's a lot of debate about that. But it also addressed teacher pay. So just
Mhm.
what you were talking about. So we set a baseline of teacher pay for 50,000 for our teachers here in the state. That was cheerleaded as it should have been, but it also raised real concerns,
Mhm.
and which often happens when you have legislation like that, which was it capped many of our veteran teachers, and now. Just a handful of years later after the passage of it, we have seen that due to inflation, that 50,000 amounts to about 45, right? So we're still seeing the issue that are seen in other states, which is that even with landmark legislation, you still have to continue to look at those things, track their progress, because we can't talk about education improvement in the state if we don't have teachers. And there's a lot of mixed data coming out about how satisfied teachers are. They're
Mm.
still committed to being teachers, still want to be teachers, but yet are feeling a lot of heavy burden in terms of what is required of them. And so I believe you and Teresa, touched on some of the negative things we saw in the Kids Count data book this year, particularly around early childhood education, which was extremely disappointing. We have significantly increased the number of 3 to 4 year olds who are not experiencing any early childhood education environment. We know that the data is looking post-COVID. So there is that element of that some parents have just decided that they want their children to stay at home. But the biggest thing, and I imagine that this is something that's common with our 3 states, the biggest thing that is keeping children out of educational settings, early childhood educational settings, is affordability.
Mm.
Right. Which is a big discussion that has been happening at the legislature, but yet we haven't necessarily come to solutions. And so, our organization is one of several that are looking at things and have proposed things around child care tax credits, or equally about child tax credits to address things pertaining to poverty in our state. And we're hoping that we're at a place where legislators are looking for solutions for our children. And one of the things that Kids Count is always helpful is showing that this is not my opinion when I come to the Capitol. This is very real data about our well-being. And for us in Arkansas, what we can show is that there was one point of time where we were much higher up in the education rankings when Kids Count came. But that was when we were making large investments in our early childhood education system.
Right.
And so it's easy for us to point and say, look at when we were a leader and what we were doing at the time that we were a leader, which was, pouring money into quality programs. And now that we've strayed away from that, started to back away from that, our rankings are reflective of the fact that we have stopped making that critical investment.
Mm. Thanks for that. It's like we said, always a whole lot more work to be done. I just want to say to everybody who may be watching the streams, wherever you're watching it, we're going to leave just a few minutes at the very end of this hour to try to ask your questions of these 3 panelists. So in the comments sections, please do leave any questions you may have. We will do our best to get to them. Also, would encourage you to talk to one another in those comment sections. Keep it civil and respectful, of course, but it's okay to disagree about how to solve these problems. Plenty of good people do, but I also think it's important to hear each other out and to really try to listen to one another. So drop those questions in. I want to stick with sort of the legislative response to the problems as we can clearly see them in the report here. And this is really a question for the group. I don't know that I'll prompt anybody specifically, but let y'all jump in if you feel led to. But in our three states, resources, help for people who really need it are limited. As we know, that's such a big problem as it relates to how to kind of solve some of these problems. What is the gap really? I'm curious to hear from y'all. What is the gap between what the research says works for kids and families and what's actually getting funded or enacted? And where might these breakdowns be happening in our states? I don't know if anybody wants to take a first stab at that question.
I'll jump in. I will just say this. I think for some of us, especially when we're talking about how, especially when we're talking about poverty, which is something that has been, our three states have consistently ranked as one of the, in the top 5 as it relates to poverty. Um, and now the country is experiencing that, right? So we didn't necessarily find a solution to that in our respective states. And now the issue of affordability is just becoming even broader, and it's touching so many more individuals, right? So individuals that consider themselves middle class are equally dealing with that. And I only point that out in terms of the gap between what is happening and what should be happening, is that I think we're at a place where there aren't really easy answers.
Mhm.
Sometimes we like to point to tried and true solutions that if we put them in place, we'll see changes within a year or so. And I think many of our problems, particularly our economic problems, in Arkansas, can't be addressed with one solution,
Yeah.
right? We have, again, poverty that could be addressed with child care tax credits, or some type of tax credit to help families with the issue of affordability. We're dealing with housing pressures, which equally could be improved by some type of legislation that addresses, again, some form of credit for housing builders. Our numbers pertaining to the rate of children that are uninsured has almost doubled in our state. There is work that can be done to help address that fact, help advise parents about what their children's eligibility is. But all of that comes with a cost. There's
Mhm.
not anything that I've stated that doesn't come with a pretty big price tag. And so I do feel like I might be kind of beating a drum, right? But when we are prioritizing how to make systems smaller, how to, provide a pathway to, getting to maybe zero income or whatever, might be a legislative agenda on that end pertaining to taxation, then we, have a real conflict with, do we want to get to zero taxes, or do we want to make the critical investments that will help pull our Kansans out of poverty and equally will address what has happened with our child well-being over the years that we have not made those investments. And I just think, it really is a decision that our policymakers and legislators have to make to get us to where we need to be. But putting it just as bluntly as I can, it won't happen for free,
Right.
and has to have not just the will, but the dollars behind it to see change.
Let me ask the question a little bit differently. And Teresa, I think I might start with you here. I mean, we're among a crew of people right here who work really hard on behalf of the people in these three states, but also know maybe more clearly than anyone else just how difficult these problems are to solve. To your point, Keesa, I think that's really it. I mean, how do you take the sort of year over year bottom of the list problems that are difficult to solve, that do cost a lot of money to solve. How do you pitch that to policymakers or lawmakers or anyone else who really might have a heart for trying to help solve these problems, but can't see clearly how it's easily done? I mean, as an advocate on the ground, how do you take this information in, distill it for yourself, and then actually share it with others about sort of how we can maybe find solutions to them?
So we always start with highlighting the solutions that do exist and have existed. So I think, going back to my earlier comment of we were able to make a huge dent in child poverty with a tax credit. And that took relatively little effort, but it did take a lot. It took a substantial amount of money, but not an insurmountable amount of money. And I think that's also really critical to remember, is that we are spending money on things all the time in this country. And there's no better way to spend a dollar than on children and families. That is literally the future of our country and the future of our state. And we need to remember that, tax cuts are always going to be popular, but it's going to take a really courageous politician to stand up and say, you know what? If we want to see these educational outcomes continue to improve, we're going to have to invest in our teachers. And if we want to see more parents in the workforce, we're going to have to help them find childcare, because there's no way that they're going to be able to work without that. And then without that work, we're seeing families face eviction, for example, because they can't work, because they don't have childcare, and then they don't have money to pay rent. So I think for us, it's really bringing up the fact that we have faced really tough challenges in the state. We saw a city practically obliterated by a hurricane, and we have come together to figure out how to make it right and to do things better. We've done it with education. In many ways, we're still not perfect. And we've also done it with health insurance. There was a time when we had an incredibly high rate of uninsured kids. And we were able to marshal not just federal dollars and state dollars, but also community members of getting the word out to every family. We had people going to soccer games, walking up to families being like, is your kid insured? Here's how you do it. And really thinking through that process step by step and getting the word out. So I just always try to highlight the resilience, but also the importance of investment.
Yeah. Here's a question that we got from somebody watching. And please do keep sending questions, and we're going to do our best to get to several here before we end the event. Could the panelists address the state of reliable data and whether they feel local and state data access is affecting their work? What do we need more data on? I think that's a great question. Ashley, we haven't heard from you in a minute. Maybe you can start us off here.
Yes, absolutely. So one of the pieces in Mississippi, our state longitudinal data system, there is a call right now to figure out how we can better strengthen the system so that different sources of data talk to each other, that they're not siloed like they've been since their beginnings. But one of the things we really care about at the Children's Foundation is better understanding child care access. So we're developing a child care access tracking system in partnership with our Department of Human Services to really think about where are we seeing birth rates in communities where the birth rate is growing. Are there enough child care seats? Are there going to be enough child care seats for them in the foreseeable future? When you have child care centers that are closing because of lack of funding and finances, what does that mean for the parents in those areas that, as Teresa mentioned, you must have this childcare in order to be able to go and make that livable wage. So this is something that we're really interested in seeing how that will work. And so this is coming very soon. Stay tuned. But this idea that when we know where there are deficits and there are gaps, how can we better address them? So, is that working alongside providers that don't serve a certain age group to expand their reach? Is it being able to find other sources of childcare that maybe hasn't been explored in that area in the past? So I think that's one piece. But I will say, yes, we still have a ways to go so that our data systems do a better job going from cradle to career. We unfortunately still have some disjointed pieces in that puzzle. And so, yes, I would agree. We definitely need some improvements.
Yeah. I'm trying to blow through some of these questions. This is another good one, I think. How will changes made to SNAP at the federal level impact your state? it's not just SNAP. I mean, we're talking about pretty consequential federal policy changes and funding changes across the board. Um, let's see, Keesa, what about Arkansas? I mean, is that you have thoughts about the federal changes and how they may affect Arkansas?
Yeah, definitely. I mean, as Leslie noted earlier, one of the biggest changes for Arkansas in this year's Kids Count report is the number of children that were uninsured. And so we had historic lows back in 2016 where we were at just 4%, and this year we were at 8%. So obviously we've doubled. And one of the things for us is that happens is we have a program called Our Kids, which has separate eligibility from traditional Medicaid.
Mhm.
And many parents don't know that. And so, they don't know that while they may not be eligible, their children are eligible. And, data and history shows us that when parents are not insured, oftentimes their children are not. And so when we think about, what's coming down with HR1, with, the Medicaid work requirements, which, as you know, Arkansas actually already took a run at several years ago, and we saw a significantly large number of individuals lose their insurance. So obviously our fear is that we will see that once more happen, and that will only continue to negatively impact the rate of children we have uninsured, because when parents are dealing with their lack of insurance, again, they're oftentimes not looking for this other form that will make sure that they were insured.
Mm.
But also, Adam, as it pertains to SNAP, we are all, I think many of us as advocates spent a good amount of these past couple of months advocating regarding, the new SNAP administrative and benefit match that is going to be required of states.
Yeah.
Arkansas is a state that did not make a specific new allocation and appropriation for our match. So we are concerned about what that means for children. We are the state with the highest rate of food insecurity. So that is, we're waiting to see what will happen with the impact, but also really encouraging our legislators to step in so that the most vulnerable in our state are not harmed. But, Adam, one of the things that Kids Count looks at and ranks that I don't think many people know the tie, think about the tie, is that we also have a very high rate of obesity. And
Mm.
so, and some of that is due to the fact that the closest, grocery store to
These
individuals
food
may
deserts. Yeah.
only have processed food. If your
Yeah.
closest food source is a Dollar General, then it's going to be processed food that has long shelf life, which is not a healthy option for many families. And so these are, all of the ties are things that we need to think about, and things that we strongly advocate to our community and also to our legislators to note the tie. Because again, if the changes that happen on the federal level increase the number of individuals that are uninsured, increase the number of individuals that don't have access to food, we are just compounding the problems that are already noted
Yeah.
in the report.
Two more quick questions for y'all. One's from, actually, there were a couple different similar questions from our viewers. And then I have one closing question that we'll do really quickly. So we only have a couple minutes left here. The first is just the notion of sort of bringing together the resources that the three of your organizations have across state lines. I mean, look, we can all have a whole hour long or more conversation about how hard it is to work in coalition, especially when the needs are so great and there's just, a dumpster on fire and you've got a pail or a bucket of water and that's all you've got. I mean, that's the reality. But, something like the Mississippi Miracle, like the success that Mississippi has had in third grade reading outcomes, is that applicable to organizations, advocates on the ground at our neighboring states? I mean, is it just talk about like how hard or easy or challenging or hopeful it might be to think about working together across state lines on some of these problems?
I will quickly say this just because I talk, so I will. I want to leave time for Ashley and Teresa. I tell everyone I love it when there are victories in Louisiana and Mississippi and Alabama and Texas and Missouri, not just because those are all surrounding states, but those are states that we have a lot more commonalities than we have differences, including political commonalities. And so it is very helpful to be able to talk with legislators and say, look what Louisiana did as it relates to their child tax credit. Look what Mississippi did on the areas of education. And I do believe that our policymakers see those commonalities and are much more inclined to look at those programs more deeply when it's our neighbors who have seen success with them.
Yeah. Great. Look, we're at time, but I'm having such a good conversation with y'all. I want to ask one more question. We're going to go up just a little bit here, over just a little bit, but really quick round robin for all three of you. If you could get one thing done in your state over the next, say, 2 years that would have the most measurable impact on child well-being, what is it, and what would be standing in the way? Teresa, let's start with you.
So this is not a flashy answer, but I feel like comprehensive tax reform is really critical in Louisiana, of making sure that we're actually raising enough revenue to fund all of the critical programs that we know are needed for kids. And I think one of the things that I didn't go into earlier is that, like, in a lot of cases, we're making the right policy decisions when it comes to kids. We're just not funding things at a level that is maximizing the difference so that every kid can reach their fullest potential.
Yeah. Ashley, what about Mississippi?
Yeah, I would say I want to build on this education success that we've had and not become complacent. And that 51% of our young children, ages 3 and 4, that are not in school, that's something that alarms me, because we can't continue progress when we're not giving our youngest Mississippians the chance to have these high quality early childhood experiences that also could lend itself to their parents being in the workforce, because childcare and these early education opportunities are provided, or something that are more accessible. So for me, it's making sure we continue to hone in on giving children and families every opportunity they have that they need to thrive. And these early learning opportunities are critical, I think, for us being able to continue to see some positive momentum.
Keesa, bring us home, Arkansas.
So I will ditto Teresa's comments about tax reform, and I will add, a commitment from our legislative body to use the funds that we have to make these critical investments. We can talk about everything from, a new, a baby bond program that reaches families that are in need the most, a child tax credit, a child care tax credit. We can make a list about investments, but you can't do that if the money's not there to make the actual investment.
Yeah. Well, to the three of you, thank you so much for your time on this. I thought that this is an incredible conversation. I've learned a lot. I hope that everyone watching has as well. Thank you for the work you're doing in addition to joining us today. I mean, it's, like I said, it's so difficult to, stare these massive, generational problems in the face and try to actually come to some solutions. And I think we can all be very grateful for the work all three of you are doing in Mississippi, Arkansas, and Louisiana. Would also like to say thank you to Leslie Boissiere for helping us understand what the data means from the Annie E. Casey Foundation perspective for all these states. And of course, thank you again to the Annie E. Casey Foundation for sponsoring this forum. And thank you to everybody who joined us today. Like I said earlier, we're going to continue the Families Count in the Deep South event series later this year with in-person conversations across the region in all three of the states. We'll also be sharing this recording after the event. It streamed on all of our social channels, so it should be available pretty quickly or immediately there. Please do share it if you enjoyed this conversation. If you can think of somebody in your networks or circles who may really appreciate having heard some of this stuff or thinking about some of this stuff, please share it with them. And thank you for being engaged with us at Deep South Today, with these advocates who are doing this hard work across the region. And thanks for, your time with us this afternoon. With that, we're going to close. Thank you again. Thank you to the panelists. Thank you to everybody. We'll see you next time.